Welcome to the details of those stories. I'll take you straight to Germany because the country's economy has been pushed into recession following a slump in investment, consumption and exports in the first quarter. That's coming according to available data. Economists are actually predicting the situation could get worse in the next quarter. Not so comfortable news. So what's in the detail and what are the statistics pointing to this particular conclusion? Thomas Sparrow is political correspondent with our partners DW. He joins me with more on the German economy this afternoon. Thomas, how do you explain to a teenager, for example, that Germany has entered recession because of coronavirus?
I would explain it by saying that the country will probably enter a period of economic decline or economic problems caused by the coronavirus, and that has to do with different reasons. One of them, for example, that people are not spending enough, so consumer spending, or for example that Germany as an exporting country is also facing problems because supply chains, so that the chains that supply things from beginning to end are not necessarily working as they should, obviously, because all countries are facing problems and disruptions. I would also say that demand from abroad for products made here in Germany has decreased, and that is obviously causing problems for the country, and that explains why Germany is facing a recession. Again, a temporary decline in economic output or in economic change or economic ways of producing, and that those things will obviously impact not only politicians, but they will also impact people directly, and that's why this issue is so important for a country, but not only for Germany, for the other parts of the world as well.
So let's take a look at this is what's happening in the first quarter. But economists, we understand, are also predicting that it is going to get worse in the next quarter. What do they base their conclusions on?
Well, one important aspect in general is to understand that when we talk about economics in general, we're talking about countries that are more and more intertwined because of globalization. That is something that you can't simply deny. And as such, when one country faces economic problems, then that also has repercussions in other parts of the world as well. And in particular, when we're talking about a pandemic that has affected the whole world, then that has direct economic impact on countries, and in particular there again, as I mentioned in my first answer, on exports, on one of the key elements of the economic output in many countries, and in particular in the case of Germany, that is certainly the case. Germany is well known for its exports, and when you have problems in the supply chains, when you have problems in the demand, then that is something that you can't repair or amend from one day to another, and those are reasons probably why many are expecting Germany to face problems not only now but in the upcoming months as well. It's important to stress that Germany's economy minister Gifty said that Germany is preparing for its worst recession in decades. So you can imagine that that's a very important element. Yet at the same time, the economy minister said that they expect to recover also in the next year, in 2021.
In the next year, in 2021, well, here in this country, our own finance minister indicated that it might take us about 3 years after coronavirus to be able to recover. But talking about an intertwined global community, do we have any idea how this can affect, I mean, what's happening, the recession in Germany can affect the so-called development partners, especially in Africa?
Well, development in Africa, and we've discussed it on many occasions here, is particularly important in Germany's foreign policy, and I do imagine that that will continue to be the case, that development in Africa, development projects with Africa will continue to be a priority in German foreign policy and development policy. But it is also the case that when you're facing very big economic problems, and all countries are facing economic problems because of the corona crisis, countries tend to also look inward a lot, and that's something that you can also expect, that in maybe in the next few months, in the next few periods, Germany will be more focused on trying to make sure that the economic problems do not affect people here as much, or that the German economy can recover as best as possible. Obviously still considering the important element of economic aid or development aid, but you can expect that Germany will be focusing inward in the next periods. And when I'm talking about inward, I do not necessarily mean only in Germany. I also mean, for example, at an EU level, because Germany's economy is absolutely intertwined with the European Union, and as such That's why Angela Merkel, the German Chancellor, has been proposing measures not only here internally, but also at a European Union level, in particular the one that we also discussed with French President Emmanuel Macron. That idea, again, is to strengthen the European Union as a whole, to make sure that countries are not suffering too much, or at least that those problems can be managed accordingly. So that's probably what you're going to see in the next few months. That idea that it's not only about here, German economy as such, but it's also about trying to make sure that at an EU level things are as good as possible, and then obviously abroad as well when it comes to Germany's priorities internationally. One of those priorities we've discussed obviously is those relationships with African countries.
I mean, this is a very difficult situation, obviously, because we're still living in this pandemic. We're not done yet. But on the back of this, it perhaps makes sense that the country is looking to open up, you know, for example, restaurants, hotels. We understand that that's part of the ease of restrictions that's happening. Tell us a bit more about that.
That's correct, but I would like to add something about Africa as well, and that's the idea, and that's something that the German Chancellor has stressed on various occasions, that this is not something that one country in particular can solve, that this is something that different countries around the world have to work together on, and as such Germany does understand that working hand in hand with African countries can be helpful, not only for the African countries but also for Germany and for the EU. And that's why I do believe that despite the fact that Germany could be looking inward a lot, it will also still try and keep and maintain those close ties with African countries. That's one of Germany's priorities as such. Now, when you specifically ask about things that are happening here, how Germany is slowly, gradually opening up, that is absolutely the case, that German states are deciding on an individual basis, based on the situation on the ground, what can open when. So in different parts of Germany, restaurants are opening, or hotels are opening, swimming pools, cinemas, and so on. And this is something that on the one hand allows German states to react fast, for example, if there are problems in one specific area or if there's an outbreak. On the other hand, it can cause a bit of confusion for many if they don't know exactly what is opening when, and when people are specifically asking for a sort of concerted action against coronavirus, something that was very good in the past few weeks when Angela Merkel was leading that in connection with all the different regional leaders.
Very interesting thoughts there, Thomas. Today is Eid around the world. I'm curious to find out how it's been commemorated in Europe or in Germany as well.
Well, it is being commemorated, obviously, in particular because there's a big population here in Germany and in Europe that commemorates that. But obviously there are social distancing measures that have to also be kept in place. So it is clear that in this particular circumstance, social distancing measures and hygiene measures are also particularly taken into consideration when it comes to this particular commemoration.
Thomas, I'll say a very big thanks to you, and hopefully you're having a piece of the Eid as well. Thomas Sparrow is political correspondent with our partners DW. He joined me all the way from Germany, where we're being told that the country's economy is hitting a recession. Very worrying situation there. But let me tell you about what's happening here in our own country. Vice President Dr. Mahmoud Bawumia says election 2020 should be contested on the achievement of the parties. He says the NPP government has worked hard enough to manage the country's finances, a record he describes as impressive. He's been speaking with my colleague Winston Amwa on the Super Morning Show and said politicians must campaign based on what they did whilst in government.
All has been already clearly set out by His Excellency the President, and he has very, very clearly said that we need to strengthen the institutions of democracy in this country and make sure that they work. Of course, for us, one of the institutions is the Electoral Commission, and we make sure that it is properly resourced and then we respect its independence and so on. That is it. But in terms of what we say, the President has always made the point that we should make sure how we speak and what we say to the public brings about peace and brings about understanding. He wants a very free, fair, and violence-free election. We want this power or the mandate of the people when we were in opposition. and so we just have to send politicians, we just have to send the message of what did we do when we had the opportunity to serve the people. What exactly have we been able to do? That is what the election should be fought on, the record, what you've been able to do and what you have planned to do also. And I think if we all focus on that, there should be no acrimony and allow the Electoral Commission to do its work. And we will all come in and participate in this great expression of democracy during this election.
Vice President Dr. Mahmoud Bawumia, regarding the economy and particularly the city, it is currently trading at 5.9 pesos to the dollar. And when he was asked about the management of the local currency, Dr. Bawumia said the indicators point to a better handling of the city.
Fundamentally, we have managed the city much, much better. By all accounts. We did arrest the runaway depreciation in the city. And therefore, if you look at the record in terms of the depreciation of the city in the last 4 or 5 years or 8 years, you'll see, that since the MPP came into power, the rate of the city depreciation is 50% less than what it was before. That is what the data shows. So it's 50% less. So yes, we have arrested the depreciation of the city. We have brought down inflation. We have brought down interest rates. We have brought down the deficit. We have increased growth. We have reduced unemployment. We have reduced the suffering of the people in the context of, paying for electricity. We have reduced the price of electricity.
Dr. Mahmoud Bawumia there, speaking earlier to my colleague Winston Amo on the Super Morning Show. This is the pulse with me, Gifty and Up here. I'm taking a break. When I return, we'll be talking about health professionals who are pushing for policy reviews to help us live with the virus, because as they say, we may have to live a while longer with it. I have people who are key in decision making in this country. The Deputy Health Minister, Dr. Okoboy, will join me, and then we also have the head of the COVID-19 crisis communication joining me. I want to hear from you. Well, I want to take your questions and your thoughts and your concerns for them on the back of the arguments being made by these health professionals pushing for policy reviews. Text us or WhatsApp us on 0540-109009. We'll be right back. So tomorrow there will be a virtual education forum on Joy Prime. Daniel Dazi will be joining me to talk about that. But let me bring your attention to this particular story we've been airing since morning. It's been months since educational activities were halted in the country as part of measures to contain the spread of the virus. E-learning then has become at the order of the day. But in rural communities without smart devices nor internet connection, where lies the fate of school-going population there? JoyNews' Kenneth Awochidako has the story to tell.
Far off in the western region is Kanbunli, located in the heart of the Nlembele district, which has a population of 87,501 according to the 2010 population housing census. The community has just about 57.7% of its population engaged in skilled agriculture, forestry and fishery work. Only 31% of the population above 12 years use internet facilities, with just about 581 households having computers.
You apply force. Are you here? Good. So the force you apply to overcome a load is called effort.
10-year-old Lina Isa has some 30 minutes to midday prayers in the predominantly Muslim community amid the Ramadan fast. The primary 5 pupil with her pen and books tunes into the community radio where teachers broadcast lessons to students in the area. These lessons are tailored for junior high school students, but Lina is brilliant enough to comprehend the lessons.
A machine is any device that makes work more easy and faster. Types of machines are simple machine and complex machine.
She's brimming of ambitions and will not let a ban on opening of schools get in her way.
I want to be a doctor in future.
A machine is a device by which a small...
Back in the studio, lessons continue unabated, but Lina too is not the only child in the locality taking advantage of the lessons. Her colleagues clutch and sit close to battery-powered radio sets to make up for the lost contact hours their urban compatriots are getting online. Martin De Porres was pushed into the program by his grandmother, recounts his initial reaction to the shutdown of schools.
It was like the world has come to an end, because when you go home and you don't do anything, then you're not going to study. You're not going to study at all. You're going to roam about, work with friends and other things. It's a sort of revision for me because I'm in Form 3 and what they are teaching starts from Form 1. So I'm recapping whatever is going on.
It has been actually entertaining and very educative too. It has helped me very much. It has educated me on my do's and don'ts at the BEC hall, and also some topics we have not treated in class, and others that we've treated in class, I've polished it and I have had a better understanding. And I'm able to ask questions. Even when I'm not here in the house and I'm listening, I can still ask questions, call and ask questions. So it has helped me a lot.
The STEM Radio School is a corporate social responsibility by Talo Ghana Limited, geared towards mitigating the plight of students in their catchment areas. Fifi Angel is the social performance manager of Talo Ghana Limited.
We never anticipated that this would reach such an extent. We've had massive support from the education sector, from the various education directors, from the teachers, from parents, even from opinion leaders. We've had calls even to extend it across the whole of the country.
Director of Education in Elembele District, Peter Ejable Akakweisen, calls for support to extend it beyond the current scope.
The subjects are limited to only 3 out of the 4 core subjects. It's English, mathematics, science. But we still have social studies that is not covered. And we still have other subject areas that are not covered. So that is for BC. So if we could even extend it to cover all the core subjects, we will be grateful.
The implementing agency, Youth Bridge Foundation, have been explaining the modality of the initiative. Dorothy Abokuma Mensah is the Talo STEM Radio School coordinator with the foundation.
We get some feedback from teachers who are also monitoring. Teachers in communities such as IRAS, etc. They are really monitoring and encouraging their students to continue sitting by the radio and learn.
As the country grapples with the aftermath of the virus, key actors in the space continue to remain optimistic of what the future holds for the rural Ghanaian child, as concerns about inequality gaps in the sector are exposed and enlarged by COVID-19. Reporting for JoyNews, Kenneth Awotredako.
Now the machine is sit there.
Well, we're getting more from those who are organizing this program there for people in that area to find out what more they can be done for them. But like I said to you, there's going to be a policy forum, a virtual policy forum tomorrow on Joy Prime. Well, as you know, countries across the world are beginning to ease restrictions imposed as a result of COVID-19. Our government is also consulting with stakeholders on the best way to reopen the schools. We've heard Information Minister Kojo Ponkruma announce that an eventual reopening is inevitable, although the exact timing is unclear. But what is the best way to ensure that schools are reopened in a way that ensures safety for both students, teachers, and other staff? Joy Prime TV's morning show, Prime Morning, is organizing that policy forum to explore this particular subject. And co-host of that show, Daniel Dazi, joins me to discuss this. Daniel, thank you for coming. Now, tell us why this forum. We do have a background, but give us a bit more detail.
Well, that background, Gifty, tells the story in the best way. These are people who have come together to find a solution to the fact that schools are not there. I'm excited to see that, first of all, a village that is close to where I'm from, Kengbuli is very close to where I'm from, in the Axim, in the Western region, is applying a solution that we suggested earlier in a conversation we had with Prof. Stephen Adair.
Okay.
He mentioned that it will not be possible for us to have virtual lessons via Zoom for children in low-income neighborhoods. And so it would be best to have radio lessons. Okay. These are some of the solutions that we have proposed in the past. This time we want to elevate the conversation and think about when we are reopening schools, which is inevitable according to what the information minister told us recently, we would have to explore some solutions. What nose masks are they going to be wearing? Should we be giving out nose masks? Should we be giving out Veronica buckets? At what level should these buckets be distributed? Where do we find the funding? All of these are various questions that we need to answer and answer well if we can come out with a guiding document that will be applied across the country. And that's why we are bringing together these experts to discuss the issues.
Talking about the experts, give us an idea. Who are these people? I mean, we did put a picture up, but give us a bit of a background into these people and how they bring, what they bring to the conversation.
So we looked across the world really, and we brought together the brightest minds when it comes to education in the African setting and also public health. So we have Professor Stephen Adair. He's well known. He's former rector of GIMPA. He's currently the chair of the National Development Planning Commission. He's also board chair of GRA. He's also a lecturer at Ashesi University. The founder and president of Ashesi University, Dr. Patrick Ewa, is also with us. Patrick is a very unique example because Ashesi University began taking steps to shut down their schools before even the country did so. They switched to virtual lessons before the general announcement was made by the president. The former education minister, Professor Jenano Pokwajiman, is also joining us. She, of course, has a bird's eye view of what education policy is, how it can be applied across the country. We have Dr. Amanda Odoi, who is a research fellow at SEGRAD. She wrote a very interesting thesis topic when it comes to education. Anis Hafa is an educationist and founder of Gates Foundation. He specializes in training teachers. And he will also be taking us to how we can conscientize the teachers there to be ready to deal with the new situations, the teacher specific. Now, Nana Kofi Kwache is the only one here who has a specialty in global public health. We can't have this conversation without looking at the public health implications of gathering. And he will be bringing us those perspectives so that with the other education, pure education solutions that are suggested, he'll be checking the boxes to see, okay, this is safe, this is not safe, this is what must be done. So we try to bring together a well-rounded panel. But since it's a virtual forum, we're also inviting all viewers and listeners.
How do people join in?
Yes, first of all, you can join via our Zoom ID. It's a system that we are setting up. And so if you want to be a part of it, we put the phone numbers out 0202 516 515. 0202 516 515. Just WhatsApp this number. We'll form a group. We'll let you know what the rules are so you can join our Zoom audience so it can be as interactive as possible. Of course, we'll be live on television and also on social media. You can join us on Facebook on the Joy Prime official Facebook page, Joy Space Prime, and also on television as well, Joy Prime TV, tomorrow 7 a.m. to 9 a.m.
So it's happening tomorrow on Joy Prime. You want to make a date with Daniel Dazi and the team. Looks like, I mean, look at the panel. Just take a look at the panel. These are people you want to hear when it comes to formulation of educational policy. Now, these are the people you really want to hear. And definitely we're going to steer the conversation in a way that tickles the minds and, you know, gives thought-provoking ideas to those who make the decisions. So definitely we'll be making a date with you, Daniel. But you did say that, what's the name again of the place, Kimberley?
Kimberley.
It's close to where you come from, right?
It's close to where. It's in the same constituency as my father's hometown, Ekwe.
I see.
And my mother's hometown is in a neighboring constituency, Axim.
I see. So when you see those young people there talking about education, and you see this small girl who was sitting by the radio, listening to not lectures, listening to
lessons.
Right. I mean, I'm sure it brings you a lot of nostalgic thoughts.
Well, it really chokes me up a bit because any of these could be my father. Decades ago, seeing in a low-income neighborhood in a village like Ekwe, seeing education as his only escape, seeing education as the only way that he can provide a better life for his kids like me who were down the line and he could not see yet. I think that these persons have taken the right priority. They are passionate about their education. They've taken the extra mile and they are taking it seriously. I think that for every child like this, we need to give them an opportunity to learn and learn in a safe environment without putting themselves in danger. I also think that for the parents, for the brave parents who have sent their kids off, who have bought the radios, who are providing the electricity, this is something that we must also salute them for. For every parent across the country, that's why we are having the policy the forum, so that if you're a parent and you're worried about what schools will look like, we are going to tell you what the schools should look like, so that you can also hold the schools accountable, especially when it comes to the private schools. So this really encourages me to see the children taking interest in education.
Good.
And I believe that this is why we are doing the forum. And
I'll definitely be talking to the persons who are behind this idea in this is the Elembele constituency, but hopefully others can learn from it. Speaking of which, you'll also be hosting, like I said, people who are key when it comes to the decision making with our new policies, etc. Joining me right after this conversation, I have Dr. Okobo here in the studio, and also have the head of the COVID-19 crisis communication as well. I'll be talking to them, and I want to hear from you. Daniel, thank you. Do stay with me, by the way, as I speak to Fifi Encho, who is a social performance manager of Talo Ghana Limited. That's the institution that's rolling out the STEM radio school, which we saw in the Elembele community there. Mr. Encho, it's good to have you. Thank you for your time this afternoon. Now, the sort of need that you identified at Elembele, for which reason you put in this intervention, can you give us a brief background on it?
Thank you very much. So for the past 3 years, Talo has been undertaking the after-school support and STEM initiative for students within our enclave, that is the 6 coastal districts of the Western region. And this is part of social responsibility initiatives, socioeconomic investments, basically aimed at providing support to students to pass their BEC. And also at the secondary school level, provide a lot more support to students to pass their WASI, and also have students develop interest in STEM education. Now, as part of it, we've had very good pass rates in the BEC for students within our area of influence, talking about the Western region, and also at the WASI. When COVID came in with the government directive on social distancing and the school closure, we then decided to re-engineer this program and then provide it on so that the support that we've been providing to students as Talo would continue, and then the benefits and also the successes we've chalked in the past would not be lost. So basically, that is the whole idea of it.
I just love to hear from you, because you have been on the ground interacting with these children, and you've put together a program that seems to be working for these kids. What would you, if you get the chance, for example, to speak to any of the policy makers? Now we're being told to learn to live with coronavirus. So if you were to advise any of these policymakers, what sort of advice will it be based on your experience with this project that you're doing in Elembele?
Thank you very much. Talo is a thought leader when it comes to initiatives such as this. And even at our place, proud to COVID, we had introduced the flexi working hours and also working from home policy. So when this came up, Talo quickly met up with the implementer, and then we had a discussion around moving this onto radio so that we do not lose the successes we've chalked. So for policymakers that are listening, and also for other key influencers when it comes to the education sector, what we can say is that we need to be a little bit more innovative in ensuring that we provide avenues where students can still continue learning. Of course, it would never be as it was before, but there are very good opportunities. We get the opportunity to reach a lot more students, and also we have the opportunity for the student to have even continuous education from their teachers who are listening in and provide the support. So I think we just need to be a little bit more innovative in the way we provide support for it.
Well, I pray that other corporate entities around the country will be able to pick up from this initiative and help the students and the pupils around those communities. But finally, what's in the future for this particular program, not just in the Elembele constituency? Do you have any plans of expanding? I understand you focus on your host communities, but what's the plan going forward?
Thank you very much. Talo is committed to the continuous support of shared prosperity. Already this initiative has transcended our areas of influence. There are 21 community radio stations that are already picking up as far as Tapa and other areas that are not even within the Western region.
Okay.
They pick the feet and then they in the communities for the children to listen. Going forward, we are still committed to our support for STEM education. Our scholarship programs at the tertiary levels will continue, and also our support to these students in these very difficult times will continue. Thank you very much.
Mr. Encho, thank you very much for joining us this afternoon. Fifi Encho is a social performance manager for Talo Limited. They are initiators of the STEM radio school, which they are implementing in remote communities. So that is what's happening in education. Whilst we are bracing up for this, all over the world, you already know that COVID-19 pandemic is causing significant loss of lives, is disrupting livelihoods and threatening the recent advances in health and progress towards achieving the global development. Well, now that I'm alone, let me try and take this off so you can see my mouth when I speak. All right, so we're being told to live, to prepare to live with the disease for a longer period, as scientists have yet to find a vaccine for the COVID-19. President Akufo-Addo has hinted that there could be easing of restrictions. We're not sure as yet. I'll soon be speaking with people who are part of the key decision-making team. But earlier on the AM show today, a group of health professionals have been speaking about policy reviews that can help Ghanaians psych up, as we're told to embrace or to learn to live with this virus.
It's important that we reduce infectability, and it's important that we align our health system with other sectors in our other sectors, i.e. economy, education, to be able to move on. It's important that we're mindful that we're going to change how we practice medicine. Do people really need to come to clinic every single time? Are there things that we can do by telemedicine? It's important for us to know that we have to change some things about family life, but that should not destroy the social aspect of our life, but we need to do it more carefully. But one important lesson we've learned from this is that we win when we work together as different sectors and different disciplines. Even in medicine, working together with the different aspects. I've had to work with public health, clinical people, the psychosocial guys, diagnostic. And when we do this, we have bigger impact. And therefore, we need to start planning to put in structures in our system, health system, education system, finance, and all the rest of it to make sure that this works. That is how we're going to be able to live with this.
I think this is a very good opportunity for us to rethink our futures in terms of education, in terms of work, everything, the economy. One of the things that has become very evident is the use of technology. Previously, there were people who didn't really bother about the use of technology. But I think that this is a good opportunity for us to relook at our policies and incorporate a lot more technology into our educational system, our work environment, our transport system, and everything, so that we can also minimize the extent of contact between people. Basically, we need to adjust in these ways. Our family lives may be impacted in one way or the other until we have a credible vaccine. Our social life may be impacted in one way or the other until we have...
I would say that if that's mandatory for people to keep all the preventive measures, when I say mandatory, it should be illegal, for instance, for somebody to go out without a mask. It should be illegal for people to operate shops or meet at any gathering without hand sanitizers, without running water, without tissues, without liquid soaps for them to wash their hands. And so as we think of probably whether the government should lift up ban on gathering, in case he does, I am looking at a situation whereby the preventive measures shall become mandatory and legal, with law enforcing agents dispatched all over to ensure that we are keeping these preventive measures.
Well, will the law enforcement agencies be able to enforce that all of us wear our masks and, you know, distance, physically distance? That's the big question, and that's a part of the conversation that I'll be having. But this same group of health professionals also believe that we might be living with the pandemic for at least between 2 to 5 years. Well, that's what they're saying. And so what then do we do to embrace this new reality? Here are their thoughts.
I think it's now very obvious that this virus is going to live with us for a very long time. We should give ourselves a period of 2 to 5 years. And so I started thinking about this quite early in the pandemic. How should our lives go on with this pandemic? Initially, it was how do we avoid the infection? How do you try and stay away from the infection? But my perspective has changed, and I think that is what we should be looking at now. And it should change to how do we live with this pandemic? How do we live with this virus? The conscientization should start right away. People should begin to fit it in their lifestyle.
So basically, if you look at what we are describing as our new normal, there are two major phases in our new normal, which are the adaptation phase and then the stabilization phase. Now, what we are doing currently is to adapt to what we are referring to as a new normal. Now, in the changing phases of the pandemic, right from the onset, where our numbers increased up to a point, people started dying and all of that, and the introduction of the measures. I think that what we need to do now is to encourage people and educate people a lot more to adapt to this new phase. Now, this adaptation phase would include, obviously, hand washing, physical distancing, wearing of masks and all of that. And once you can get a lot more people to adapt to this phase, then gradually we can get all of us stabilized, and then we would be able to live with this virus for as long as we wait for vaccines to be developed.
So again, just as Samuel said, there is an adaptation phase, there is a stabilization phase. We speak of the new normal, not purely as a situation where everything goes back to the old normal, and that's why we keep calling this new normal. As Ruth said, this virus may be with us for a bit of a time, but it is what impact it is having that is more important than it's been. There are viruses with us, living with us, causing no problem, or even when they're causing problems, the measure of their problem is significantly insignificant, in which case we tend to ignore them and live our old life.
So you have those doctors that I spoke to earlier on this morning. Let me give you their names. They are Dr. Samuel Essien Beidu. He's a microbiologist and immunologist at the University of Cape Coast. He's the one that spoke first. Dr. Ruth Owusu-Entry is the head of the psychiatry unit at the Komfanochi Teaching Hospital. She's the only female among the lot. And then Dr. Christian O, I beg your pardon, he's a consultant anesthesiologist and head of ICU, Kolebu Teaching Hospital, also University of Ghana Medical Center. He's also in charge of the National COVID-19 Case Management Center. So those three spoke to me earlier this morning. And you heard all the points that they make. They talk about moving to a stabilization state where we all psych ourselves to live with it so we become comfortable in the new reality. I have two people here in the studio with me, part of the key stakeholders as far as this conversation is concerned. What do you think about this? Send us your thoughts to our WhatsApp platform. I shared it with you earlier. That's 0540109009, and I share it with my guest. My guest for today, like I said, Deputy Health Minister Dr. Okoboy. Dr. Okoboy, you're welcome to the show.
Thank you, my sister.
And thank you very much for coming as well. I also have here the Director of COVID-19 Risk Communication, Dr. Dacosta Abuaje. Doctor, welcome.
Okay.
So I don't know if you followed what the points that these health professionals were making, but And I know you've spoken to MFA Pao earlier also on the beyond the lockdown. But it looks like gradually we're getting to the point where we're being told that, look, brace up. You see that there's no point of return, essentially. I mean, maybe in the next 5 years or so. So we want to have a discussion about how we brace up. The point they're making essentially is that we need to make policy reviews. When you had one of them, you indicated that some steps have already been taken, especially regarding outlawing people's disobedience to observing the social protocols. Tell us a bit more about that.
Yeah, so let me say a very good afternoon to all your viewers. What I can say is that it's good to give a quick update of our current situation.
Right.
You know, currently the total cases we have 6,808 cases.
Yeah.
But I think I would also engage the GHS team more so that we see how we can capture some very essential information.
Okay.
You know, the 6808 now also includes all those who have recovered.
Yeah.
Includes those who have died.
Yeah.
In fact, it is the total case count can only go up because you're just adding cumulatively.
Yeah.
What shows you the picture in your country, and that figure can actually go up or down to tell you what is happening currently, is the active cases. Active meaning deduct the recovered people who are no more here, deduct the deaths, and then you are dealing with what is in hand now, what we refer to as the disease burden now. So I just did a few calculations for us and realized that currently, the last one that I checked, as in 23rd, this update was 23rd, that's 2 days ago. Today's 25th, right? Yes. And the last update was 4,000 for the active, 4,706 cases.
4,706 cases.
Yes.
That's
now,
the cases, the total case
active.
minus, the total case minus the deaths and recovered. Okay.
Good. Now, I just did, I just went backwards and calculated the active for all the updates we had.
Okay.
I wouldn't bore you through all, but just for you to realize that sometimes it can go up and go down. And that's what we really must have our attention on, because that's what is real. So somewhere on the 8th, we had 3,863 active cases. This was 8th of May. 13th, we had 4,832. Now, on the 14th, it came down to 4,150.
Okay.
And then for the second consecutive time, it came down to 3,952. That's the 15th of May. Okay. I got very excited. I was hoping it goes on the downtrend, but we came up to 4,133.
Okay.
And then to 4,2, and finally to this number.
Why do you think we're experiencing this trend? Because it looks like it's fluctuating.
Yes, of course. So usually what happens is that when you get new cases, they'll come and add on to the active. Should you get deaths or recoveries, they come out. So it's the net. So once the net is going up, it means the number of new cases is more than the number of deaths and recoveries.
Yeah.
Now, it is so according to the current figures you're having. If this evening they do the testing for 100 people who have tested negative once, and their second result can say negative, there would have been a big reduction from the active. Okay. So I just wanted us to know that the 6,880 doesn't tell you much.
Okay.
What you must have your interest in is that at any time, what is the active count?
Okay, is there a reason why the Ghana Health Service is not giving the updates this way? Is there a reason, a specific? I had someone ask this question today. Why do we give the entire figure?
So globally, I just checked my figures before coming here. They always give you the global count, about 5.53 million. Then they tell you the number of deaths recovered, and it comes to active count.
All right.
So it's a reporting style. It's an international one.
Okay.
But my point is that we want to do some special service to our people. So you want to also tell them, apart from all the figures you've given them, the essentials, the ones that will tell them whether we are going up or we are going the other direction. Okay. And the active case count is a very, very good indicator, and we'll still engage more so that going forward, if it's even possible, the active case count should be what stands out.
Okay.
If you go into the details, you'll be given the total case.
Okay, but right now that we have already started communicating the figure, the total figure, if we should go...
No, you not stop giving the, how do you call it, the total case.
Okay.
It will still be in the data.
And then add active cases.
Exactly, but what you highlight which is the current disease burden, would be the active. We'll still engage.
So let me bring Dr. Da Costa in here. Why is it that we haven't thought of, I mean, this risk communication, you're head of the risk communication, COVID-19 risk communication. Why haven't we thought of this? Is it that it doesn't really play an important role in managing this disease over the months that we've had it?
No, we've really thought about it. It's not all the data that you see. I mean, obviously, it's not everything that he's saying that maybe he just need to verify. But, I mean, let's really today focus on our topic, how we institutionalize.
No, we will, but this has come up, and it's important that we speak to it, and because this is supposed to be your area.
Like he's saying, he just have to engage to get more data. And certainly I believe that all the data will be there for him to. So if you contact Dr. Esiedu-Bequin, you will get everything.
Would you then concede that this is part of, you know, the shortcomings of our communication strategy as far as dealing with this disease is concerned? Because then it gives people the certainty of the real figures that we're dealing with.
No, you see, internationally, we have, like he rightly said, we have a way of reporting. And if you are going by the international standard, because bear in mind, WHO, all the other agencies, they are all taking our data, so you have to conform.
So this is a standardized way of going about it.
That's a standardized way of reporting. But if you want more detailed data, you can always get it.
Okay. Well, I think that people, those who are watching us, will agree with Dr. Okoboy as he's saying that going forward, perhaps we need to look at some of these figures, see what it does to us. So I was asking you about your thoughts, your response to Dr.
So what happens is that if you look at the SARS virus, which came somewhere in 2003, it stayed around for just about 24 months. And then it went. Same with MERS, which was around somewhere 2012. When a virus comes into the world, it leaves quickly when you have either treatment or a vaccine. It's the vaccine that will prevent others from getting it. But in the absence of a vaccine, when a virus is very contagious and spreads quickly, those who have it at any point in time might be more than those who are recovering. So that at any time, you have more cases on your hand. Now, when you look at the global count, now there are about 2.86 million active cases. In 3-4 weeks, about 2 million can recover. If no one gets, if we don't get any new cases,
which is not possible at this point.
Which is not possible. You'd have expected to drop to about 864,000 and then continue to vanish. But as people recover, others also get it. So with such counts globally, immediately, in the absence of a vaccine, you realize that this is something that will be with you at least for the next 2 or 3 years. All the scientists who are involved in development of vaccine have indicated that we are likely to get a vaccine maybe first quarter of next year. Now, when a vaccine arrives, usually within 12 months, you'd have had about 80% of the cases going down because people will not get it. Those in high risk,
there won't be new infections.
Absolutely. So for now, we must learn how to live with the virus. And when we say when we talk about learning how to live with the virus, it's not new. All we are saying is that learn how to reduce your risk, your chance of getting a virus. Just as we've been taught how to reduce our chance of getting other diseases, like ABC for HIV, abstain, be faithful, or condom use. Like stay indoors when it is dark for malaria. If you have kids, sleep in mosquito nets. Like wear your seat belts when you get into your car. Because over 7,000 people die in this country annually from road traffic accidents. Like telling people that be careful to cover your even before COVID arrived. We've been taught to cough into your handkerchief. Because when you cough, TB can go to others. That's how it spread. So basically, all we are saying is that try to live your life, get back to life gradually at normal life, but take all the precautions.
I think that's a point that's understood. But right now, the issue is where do we go from here? Which is when you are coming, because when it comes to decision making that govern the way we behave, I think that you're key in doing that. So the doctor that spoke, the psychiatrist that spoke said, it's about time that we outlawed some of these things. You indicated that the LI, the executive instrument has it, but are we really, as of this point, based on perhaps the work that you've done already, are we really observing it as though it is law?
Yeah, so once there's an executive instrument, in fact, the one I read, my boss, Honorable Kuku Ajimamenu, he worked on it together with the Attorney General's Department. It's an executive instrument on wearing of face mask. Yeah. And an EI is law, actually. Yeah. Yeah. And it even mentions also the punishment for not conforming. And the mask, the EI mentions wearing masks in public places and actually lists them. And it captures places like the markets, the schools, in Trotro and all that. So the point is that you can appeal to people and educate them so that they conform. Okay. But in order to get, how do you call it, a backup to those who will be very resistant, exactly, you must have some form of law. And this one is actually stemming from the Public Health Act, which gives the Minister of Health that power to enact executive instruments to protect the public.
Let me bring Dr. Dacosta in now. This is a very dicey situation. Okay, this is a public health crisis. Yeah. So arresting people, first of all, we don't even have space to be keeping the people in our prisons. Already, those who have been arrested are testing positive. Some are testing positive. Some are our officials have been exposed, and all of that. They are in quarantine and all. What is the communication strategy that's meant to get people to actually psych up? Because that's the point that the doctors I spoke to this morning make, that we need to get Ghanaians to a point where they are psyched up, that you don't even need law enforcement person to tell you that you should do this or that. What is the strategy?
Thank you very much. I think let's take this into perspective. Okay. You see, first of all, yes, there is the EI, but you see, wearing of masks is something new in our continent. So it may take time for people to even adapt. Okay. And bear in mind, this is a pandemic that keeps evolving, so the messaging keeps changing. So as a specialist, what you have to do is, you have to, what was your initial plan? For example, initially, we certainly knew that the disease was not in our country, but we started preparing, putting measures in place. Immediately it came into the country, you have to change your plan. In fact, if you look at our initial poster, we were even saying that people should not wear the mask. Initially,
because it wasn't clear.
It wasn't clear.
The extent to which the mask protects.
Yes, now this is the case, we say it is mandatory. Now let's look at availability of the mask. Is it even there? If it is there, yes, you have to continue the education. What strategy are you using? We are using community participation. We are using the above the line and below the line. This is why you see that we keep training like the Information Services Department unit, because they have a larger facility in terms of their centers across all the districts to provide information to the various masses. The health directorates are also doing. We are using the traditional leaders. We are using opinion leaders like the local assemblies. So
is it working?
Well, you see,
in your honest perspective, I mean,
working.
This is a global crisis.
I'm going to show you a research that has been done by IP, because I represented Ghana by, I delivered a presentation, I think, last week to World Bank, and the IPSO has done some sort of a survey, and they were looking at the awareness level or the education that Ghanaians are receiving in terms of this pandemic, and they gave us 82%. So the point is, you see, and let's look at this. So I don't know, unless that's the only way that we can measure our performance. But when I step out to the market and I see people not wearing the mask, when I ask people to wear the mask and they say Kwejeno, then oh, sorry, Kwejeno is like I don't know.
You're welcome.
That's not true. Okay. That's not Kwejeno. Okay. I'll try.
Don't bother me.
More like talk to the hand.
Or leave me alone.
Yes. Then I, as a reporter, I'm worried, and I'm saying that it's not working. I mean, it's not comfortable wearing this. I'm suffering wearing it. rate anyway, but it is necessary. So when they score you 82, I'm saying that unless that's the only way to measure our effectiveness, which other way have you measured the effectiveness of our communication strategy?
Thank you so much. You see, we have developed our communication tools, the assessment tools. We have the knowledge, we have the attitude, and we have the practice. That's what we normally use. So we visited the Pentecost Isolation Center and other places to ascertain what is actually happening in the country in terms of people's awareness and others. And based on the challenges, we use that to develop the tools as part of our public health measures. So we will be using that to really assess the real educational levels of the people in terms of all this. But like I'm saying, you see, it will take time before it sinks in. And it is not easy. You can see that it is not even comfortable.
I understand.
But the point is, you see, you have to make sure that this is why we have adopted all hands on the deck approach, where everyone is, because education is also continuous anyway. So our strategy was actually to use the media. So we trained 475 media personnel across the country to help us. Because my division, for example, is new. So the information minister has been doing fantastically well. He's actually helping us with, and not only him, the NCCE. The
NCCE is a whole different ballgame.
Yeah, I know.
But NCCE had not had, I mean, I had the woman here, had a conversation.
I wanted to say something. The last
I just wanted to just refresh the memory of my viewers that the NCCE at the time they came here had 100 cities each to each district. This was about 2 or 3 weeks.
And I'm telling you that, and I'm telling you the current situation.
No, things must have changed, but that's the problem, because people said that if NCCE is seen as a key communication tool by the government, why didn't we empower them at the beginning? But that's okay, let's move on.
You see, look, we have the advisory committee. The advisory committee, the deputy NCC boss is there. You see, that's what I'm saying. The point is, at the last presidential speech, what did the president say? He has given 10,000 marks to what? Them, and it has been received at the information ministry for them to
I'm not disputing that. All I'm saying is that I'm just drawing your attention to some of the mistakes we have made, and this is something that all the Ghanaians that have spoken to us have indicated we could have done better, so that we don't repeat them essentially.
There is always ways to improve things. I'm not disputing
that. But these masks went to the people when we had the first case in March.
Yeah, but I've told you that even for masks, we were not even supposed to wear the masks. It just came in. So things will continue to change. Things will continue to change. And it will continue to evolve. Now, my point is, you see, as we continue to as we move into the next phase, if we have to, then it means that people must take the preventive measures very seriously. Institutions must actually make sure that they put structures in place so that the workplace workers can also comply.
Which is why we're having this conversation.
Yeah, this is why we're having this conversation. So it's very important that...
But we won't be able to, I bet we won't be able to touch on every aspect. I wanted us to look, especially because we've got the Deputy Health Minister here, to look at how things can change, or the institutionalization of the new reality within the health sector. For example, the doctors were talking about deploying technology and all, but I don't want to hijack this conversation from our viewers. I want to take you through some of the questions that I've had. Okay, now I have to be very, very, very careful with these. Okay. Okay. So let me see what this one says on Facebook. It says, this is Africa, where we can compromise on ordinary virus, yet the virus has come to live with us, so that some people can get 10% anytime they buy test kits and managing drugs. God have mercy on us. I'm not sure I understand that. It says, as for our herbal medicine, nobody wants to talk about it. Okay, so I guess the point is there about herbal medicine. This morning, most of the people who called in were talking about Madagascar, and they wanted to find out what we're doing about that. They wanted to find out about our own herbal research institute here and what we are coming up with. So that's it. Eddie says, ask the government what they're doing about the airport. A blanket closure is not the way to go. Open the airport for essential travel so that those who earn their income outside the country can go and work to support their families. Seafarers are stuck in the country with no income, but those who work in the country are allowed to work. This is not fair. Please consider the plight of seafarers. Thank you. I'll take the last question, then we'll take some answers. Amankwai Beneza says, I'm surprised about what the government and information minister are saying we should live with the virus. That cannot be possible. The mode of transmission of this virus is different from HIV. Please, if we decide to lift the floodgates, the number of infection is going to overwhelm our hospitals and health centers. So the idea we should live with the virus is something we should not encourage. Again, what about those with the underlying health conditions? We should allow them to die, or what?
Okay, so when you look at a country like UK, their mortality rate, number of deaths for the COVID cases, UK is doing, in fact, UK has a rate of about 13%. For every 1,000 cases, they lose 130 lives. South Africa has 1.89. South Korea 2.3, and the president mentioned the last time that we have one of the lowest mortalities in the world, if not the lowest. It didn't happen by accident. It's because we are aggressively testing people, even when they have no symptoms, picking them out and giving them supportive treatment. You do these things to make sure that your disease burden is always very low. Now, we with the lowest, this country with the lowest mortality, and one of the lowest morbidity, meaning those who are sick, is one of the low. In fact, currently, out of the 4,706 active cases, only 15 are sick. Sick meaning that severe to moderate illness.
Is it 15 or 16?
The last time
we heard it was 16 in critical condition.
Absolutely. Now, 1.5 and 1.6, if you calculate the percentage, it will be around the same place.
Okay.
It's 1.5. Severe illness. I just checked the last update.
Okay.
Now, morbidity, that's percentage of people who are sick, is 0.3. What it means that 99.7% of our cases are either without symptoms at all or in a mild state. Now, our picture compared to the rest of the world is very encouraging. Even UK with a percentage of 13% is easing restrictions and making people start going back to life. Germany, with a percentage that is worse than ours, is easing restrictions. South Korea, and the reason is simple. If you sit in your room on a lockdown, you are taking water, you are taking food, you are taking some medicines if you are hypertensive or diabetic. You are feeding on stock that has been put there before the lockdown. After some weeks, when stocks run out, should you stay in your room still, you can die. So the world, if the world stays in a lockdown beyond a period, what happens is that the risk of death or disease increases for other conditions. And that is why Germany, South Korea, Spain, Italy, everybody is trying to ease restrictions and go back to life as normal. But they are not doing it in a haphazard manner.
No, they're not.
They've put guidelines in place so that your risk reduction level is very good. You reduce your risk. But you must still go. And I use the example.
Can we say for Ghana that, for example, the measures that Germany is putting, and every week we talk to Germany, we have our partners, DW. I just spoke to them before you came in. They have actually entered recession. The country's economy has actually entered recession
which is
today. Yes, it is. But they're still going ahead. They're easing the restrictions gradually. But they started easing the restriction when we were still, I think, almost done with our lockdown.
You know,
but they did it very gradually. Can we say for Ghana that we have the same systems that they have?
In fact, even countries with disease burdens that are worse than ours have had some of their schools opened. Kindergartens have opened in some countries. Germany, like this, they've opened. I think they're about to open.
They're still working on it, but they're taking it very gradually. Very gradually.
As we speak, our schools are closed. Our churches are closed. It is an indication that we recognize the risk in the global population.
There are indications that the restrictions will be eased.
Just as Germany gave you indications.
When the next president speaks, will there be an ease in the restrictions?
Obviously, I cannot preempt my boss. But the point is simple. Should we open any of these facilities, it will come with guidelines. to help reduce your risk and make sure that your chance of getting the disease will be very low. Look, I mentioned the seatbelt issue. It's a very serious thing. Science proved that when you are in a seatbelt, your chance of death is very low when you get an accident.
But people know that they still die without wearing
I'm coming. But there were many people who were refusing to wear the seatbelt, saying it was uncomfortable. They brought in a law. In most countries, Ghana now is also law. If you are not in a belt, you are charged. Why do we charge you? We charge you because the science has taught us that it will save your life. So it's no more about what you think or what you want. And when we say we have to live with the virus, please, it's science. Let me explain shortly. Most viruses that come into the world can vanish in about 6 months, 1 year. When you have a virus, that as a result of its level of contagiousness, the global count that you have is in millions. And you have an idea that people recover within 2 to 3 or 4 weeks. Simple modeling will tell you that should it vanish in the population, it can take about 2 years or 3 years without the vaccine. It is the modeling that has been done that has taught us that this is a virus that will still be around in the next, let's say, 3 years. So you are told to psych your mind to live with it. It doesn't mean we are not doing anything about keeping it low or keeping people safe.
And that's fair enough. But I think that the concern that people have really is that we have seen the seatbelt example, perfect example you give. But we have also seen people die without wearing the seatbelt, even though there are laws. So the idea is, what sort of lessons are we picking from the past examples, you know, to help us deal with the problem at this point?
Before it comes in, always remember, when they say in Germany that they want kids to come to class in the staggered manner, they want to keep their breaks low. Every measure is to reduce your risk. Keep populations low at a time, at any place. Risk reduction doesn't mean you are exempt. So they say if you're overweight, you can be hypertensive. If your mother has it, you can be hypertensive. All these are risks. Someone can have all this and still he has no hypertension. So remember, whenever we are talking about risk, it doesn't mean that there is no exception. And don't say that there are people who wore seatbelts and died. So even if I wear it, it will not make any difference.
No, the point I'm trying to make is that we know how people behave. So based on behavioral patterns, what are we learning from the already existing laws that we've made to make our experience with coronavirus, living with it, better?
I think deterrence will help us. You don't need to arrest everybody not wearing a mask.
Where are we going to keep them?
No, I'm making a point.
And I'm saying that even if we arrest them, where are we going to keep them?
Listen to me carefully. My point is that if you have 1,000 people who are not wearing masks, it's because people assume that when you don't wear it, it comes with no consequence. If you ask one person to just, let's say, pay 50 Ghana or 100 cedis, and it is known that someone was charged 100 for not wearing a mask, people will fall in line.
So we're looking at fines.
Yes, it's also, fine is very, very important. And please, there's a difference between knowledge acquisition and behavioral change. Don't make that mistake. When you see someone not wearing a mask, it doesn't mean he's not being informed that wearing the mask is good for you. Human beings by nature, because we exercise freedom, sometimes we decide to do what we like. And that's where it's important to have laws to support compliance.
Which is where my question comes in, that whilst we are doing these, we're putting in place these laws, we're taking into consideration the laws that we have done in the past and the things that we've seen people do even though the law existed, and how we are, you know, working to change that. So fine sounds interesting to me. Is that part of the trust strategy? Dr. Foster?
Certainly, there must be enforcement. That one, no two ways. And I believe that it's actually like the health minister, when he issues the executive instrument or the public health act, in fact, it came with enforcement. But like I explained earlier, you see, that you have to take it in totality and assess the situation and know we will finally get there. But at the moment, to me, we certainly have to make sure that, for example, let me tell you something. When we said people should be wearing the mask, what did the government do? He actually said that, in fact, PPEs were very, very difficult for us to acquire internationally. So the government's innovation was that, okay, let's see how we can produce it locally. Immediately, 5 companies were contracted to produce with a target, and gradually we are getting there.
Okay.
Now, so certainly we will get there. But I wanted to add something to the science behind some of the things that we're doing, as the Honorable Minister talked about, Deputy Minister talked about. You see, in health or in science, we have something we call determinants of health. So when you want to take a decision, for example, in health, you consider the determinants of health, which is the economic, the social, the housing, the agric, the environment, and all the others, and the transport. So when you consider all this impact, then you can make a holistic assessment, and it will inform the decision that you have to make. And it's exactly what is going on. If you remember, during the lockdown period, all these things were taken into consideration because there was an economic implication, there was a social implication, there was transport implication, and it is the same thing. So the government approach to this was that, okay, let's look at how we now consult people for participation, such that let's look at the next phase and see what is industry, what are the other stakeholders contributing to the decisions that should be made.
So it looks to be as if we're already heading towards the next phase, which is why people are asking questions. But no, you didn't mention, you didn't tackle the question about locally produced cure, if you like. Okay, that's the question that lots of people are asking about Madagascar and all. Last time the minister said, the information minister indicated that we've not taken any delivery of that. Where are we as far as local healing?
Yeah, you know what? The close to 2.3 million people who recovered from COVID globally, and this includes our 2,000 plus recoveries.
Yes.
They didn't take any magic treatment for COVID. Most of them were given supportive treatment, like vitamins, making sure your immune is in a good shape, eating well, rest, and all that. So largely, we recover or battle against COVID on our own strength, as in our immune system.
But are we not looking into?
No, I'm coming. I'll address that.
Okay.
Because you can have COVID cases who are not given anything, but can still recover on their own.
Yeah.
There are folks who have preparations for, let's say, immune system. And because COVID is fought with your immune, they say that, okay, if I give this to you, it helps with your immune. And because that can help you stand COVID, then more or less it's a COVID cure. But science, we are very careful. Precision is important. I have cited documents at the ministry where the ministry has facilitated the testing of a lot of, in fact, at least our 30 plus medications.
We didn't find any that works?
The results showed, the scientific results showed that some of them have some level of viral activity or some level of antimicrobial activity. But for you to say that this is a COVID, how do you call it, drug, it must be tested on a COVID positive person or must be introduced to a COVID virus, and there must be evidence that it has been able to defeat the virus.
Are there plans to do that?
The recommendations in the letter show that those are tests that we have to advance to from the initial ones that we've done in Ghana.
So when are we doing that?
No, I just stated this for the public to know that the ministry and government is very supportive of every initiative, especially with the herbal preparations. The only caveat is that you should be careful not to use only patriotism to be the foundation for giving someone a drug with the hope that it can cure. Because if anything happens, they will not take the excuse of patriotism. So we are supporting them, but we also want to go through the motions. But for now, most of them that have shown some immune boosting capacity have been approved as what? Supplements. That one, globally, everybody will understand. But to say it is a COVID drug, that's what we are being careful about. Yes.
Okay, Dr. Dokosa, I don't know if you want to add anything. We're fast running out of time. I don't know how that happened.
Let me put it into perspective. As it stands now, we have no medication for COVID patients. In terms of a vaccine, a tablet, we have not. What we are doing is to manage the whole world. They are managing the symptoms. exhibited by those patients. That is why you hear this vitamin C, this, for example, if someone has pneumonia as a result of this, then they manage the pneumonia with antibiotics, and so that should be clear. Now,
that's why people are using neem tree.
Yes,
because they believe that it boosts your immune system.
Yes, so, and it's the same thing that he's saying. So what he's saying is that, for example, we have engaged the plant scientific community, and their products should still go through the approved processes, so that when it is seen to be efficacious for COVID patients, then it will be declared as such. But if it can only manage, let's say, you can use it to boost your immune system, then it is a supplement. It is, so that's what he's trying to say.
Okay, I hope that we've answered that question. That question came up a lot this morning, so I hope that whilst you're at it, Doc, I'd like for you to add the question about our airports. This is some people, they work outside to feed their, so if we're talking about the economy, now that Germany has gone into recession, we are protecting ours and trying to be sure that we don't go there either. So for people like that, what do we do?
I think, let me quick, before I come to that, mental cases in the US, conditions that affect people's mental state negatively have gone up by about 60+% in men, and women about 33%. Over-the-counter drugs for anxiety medications have gone up by about 34%. Now, this means that we have to do communication on COVID very well, so that you don't only speak about the mortality, but also speak about the other part that tells us that it is not a condition that they should let you go and commit suicide. So let me quickly tell the whole public that this is a condition that had very, very low mortality in this country. 4 people out of 1,000 are likely to lose their lives if they get COVID. 4, compared to hundreds elsewhere. But we tell you to take good care of yourself, because we don't know who these 4 would be. It can be your mother, it can be your sibling. And should it be your relative, you will not listen to Dr. Koba when it says 4, because in your house it is 100%. Now, I say this so that people will know that there is hope in the world. But let's engage in risk reduction behaviors. Make sure that you wear the mask, wash your hands frequently. I was in Lekma Hospital this morning. The risk of getting COVID in this studio is lower than in Lekma Hospital. But I went there knowing that I was going to engage in risk reduction behavior. So I wore my mask. For every patient, I was cleaning using the sanitizer, and made sure that I had my lab coat, which I safely disposed after work today. So that's the way we should all go. Now, the question that was asked.
I've run out of time, so
sorry,
let's wrap up on that.
The airport question tells you something. When people say, why do you want to put economy ahead of lives? I laugh.
I think you explained that.
Exactly. It's actually lives over lives.
But learning to live with the virus, does it doesn't mean that we lift some of these restrictions?
So I wanted to remind people that these are real lives. Someone says that's economy for the one who has a question, but that's his life. Maybe you cannot buy drugs for the child when he's sick, and that can lead to death. That's another risk, which might be bigger than COVID. Now, so the airports can be opened in the future. What do? You have to think of other things. Maybe we have to screen every passenger. Maybe when we have approved rapid test. We've used the thermometer gun, but its sensitivity to catch people who are COVID positive is lower than the rapid test. So maybe we do rapid test. We can flag people who are positive or at risk, separate them, and let others come to the country. We have to go back to life as normal, but in a graduated, very cautious manner.
Okay, I think that we need a lot of time to be able to do this, and I believe that with time we get, the communication.
The virus needs time.
I know, right? And I believe that with time people get the communication, drummed into their heads. I'm not sure if I'll be able to take your final comments to wrap it all up. As in, what should people take away from this conversation today? And without feeling that they wasted their time.
Okay, thank you. For me, the takeaway message is for people to adhere to the preventive etiquettes. Wearing of the mask is very important. It is mandatory. We shouldn't joke with it. Social distancing is very important, and our market women should really adhere to them. And also, when you are talking to someone, don't just go and stand in front of the person, because bear in mind, this is spread through person-to-person contact. So don't just go and stand there for the droplets to get to you. And when you sneeze and cough, please, Cover your mouth with tissue. Disposal of the tissue is very important. Right. Dispose it properly. And also try to eat well. Eat our local food, our kontomires, our dawa yasantua. All those things are good.
All right. Okay. All right. Well,
yeah,
I say big thanks to you.
Yeah, you don't have to meet the virus before you believe it. Yeah. Just as we've not seen Christ before, yes, but we believe, yes, you also have to have that same attitude. Yes. And I'm happy that most Ghanaians say they are Christians, and faith plays a role. Believe the virus is around. That's the way to save your life.
Having said that, though, today is Eid, so for the Muslims as well, they believe. Yes. Some of them have not seen Muhammad, but they believe he's a prophet of
So
God.
this is a country where faith is strong, and for the first time, we need faith to manage this condition. Okay. Some of you have not seen HIV before, but you're careful.
We're very careful. Look, it's so good. It's been very good. I mean, I don't know how the time flew, but I hope that we've been able to answer some of the questions on your mind, and I hope that gradually, as we go along, we're bracing up for the new normal. Yes, the new normal, because life must go on.
But you know, you've braced yourself for the new normal. You're talking to a mask. That wasn't
I am. I mean, I am.
I hope it's so.
I am. Yeah. Okay, I've been talking to Dr. Okoboy. He's a Deputy Health Minister who has been good to us this afternoon to come explain and share, answer some of your questions. I also have here Dr. Dacosta Abwaje, who is in charge of the COVID-19 crisis communication. We're looking at living with the virus. Some of you are not very enthused about it, but we'll get there, hopefully. Thank you very much once again. Well, it's one of our top stories. A landlord, Victor Stephen Nana Kankam, has allegedly shot and killed his tenant, Benjamin Autry, at Ofankor Sport M here in Accra. The action is in connection with the tenant's refusal to move out of a two-bedroom apartment yesterday following the expiration of his rent. Well, the landlord is said to have written to the tenant demanding he moves out exactly yesterday, but the tenant refused, leading to the incident. According to eyewitnesses, the landlord went to the house yesterday afternoon with a bulletproof, wielding 2 guns. He's said to have shot the tenant 4 times. The tenant has died. We've been speaking to some eyewitnesses.
We are not so about threatening soon too. Several times, I'm no lazy or the man. To one crowd, Kunya down a larger, watching in Emma, I'm a car wardrobe on any TV and can run or train car. Now, Babafa. Until she dance on a face or bad, they be about Cobopunum, but I'm not the 2 Cobopunum or friend phones. To friend phones or buy or brigade now, and so, or sunny to Gunoso. On all banner of 100 and not bulletproof. No kutani to the lawyer canon and to no na obey. And a number for one Omoda boy and rats are number for no. Omoda Homtia who to nipe ama while you're ready so overco. What training them may be a queen down while a larger or training them a content banner when you're trying to watch you to know. Into one so can be a fasten and they say who answer or inside the
some eyewitnesses there were family members of the alleged killer says he shot his tenant in self-defense.
My full name is Victor Stephen Nana Kankam Ni Konim Anukba III Obu Schroeder. As I said, I wouldn't like to have no comment unless legal representation, but as I'm here, I acted in self-defense. Yes, madam.
And see, no rust even can come. I can say, on to me, I just say, ne lawyer ever around. Now, to see there, no can say, no, yeah, no, or yeah, at the born home by an self-defense or the general. If he, Niana, Benjamin, and so air the Etian into born home by, no way to me, I can't.
Well, that case is now with the police. They're looking into it. We're told that the body of the deceased has been deposited at the police mortuary for preservation and autopsy. There was a search also in the house of the landlord, and they've retrieved from the scene 4 spent shells, and they've also retrieved 2 pump-action guns loaded with 7 and 8 rounds of cartridges each, and 32 live cartridges also retrieved. We'll get more from the police later on JoyNews Prime. There is more news at myjoyonline.com when you do log on. Happy Eid to all of you. My name is Gifty Ando Apia. Remember to have your masks. Remember to stay safe. Have fun with Let's Talk Showbiz.